Good morning, good afternoon, everyone. Welcome to this webinar. So good morning, everyone. Welcome to this webinar on strengthening social health protection towards universal social protection and universal health coverage, a shared endeavor. The webinar organized by the International Labour Organization and the socialprotection.org platform, supported by Belgium, Luxembourg, and the Swiss Development Corporation. Next slide, please. So today, your moderators will be Nathalie Both, who's project manager at the ILO based in Vientiane, Laos, and myself. So I'm Mathilde Mailfert, Health Financing and Social Health Protection Technical Officer at the ILO. And to open the floor today, we have the honor of having Valérie Schmitt, who's Deputy Director of the Universal Social Protection Department of the ILO based in Geneva. So just a few essentials before the start of the webinar. So this session is being recorded, and along with this presentation, it will be available on socialprotection.org and sent to all registrants after the session. There's a Zoom AI that will generate automatic captions. So to see it, you can click on the CC closed caption button of your screen. Then very important one, we will have simultaneous interpretation for this webinar in Arabic and French. And to see them appear, you have to click in the button interpretation and select the language that you would like to hear. And then there won't be any Q&A for this session, but you can use the chat box to introduce yourself and make a few comments or share useful links. Next slide, please. Okay, so this webinar is part of a webinar series on building social protection floors for all. And this webinar series showcases some of the key achievements and the future priorities of the ILO's flagship program between 2021 and 2025, with all the different progresses on different thematic areas being presented to you in connection with ILO stakeholders across regions. Next slide, please. So today's session will particularly focus on social health protection and coverage extension, and it will showcase success stories of technical support and joint engagement with partners across social protection and health. Thank you. Next slide, please. Okay, so for today's session, we will have an opening remark from Valérie Schmitt for 10 minutes, and then we will have 3 different segments with a panel of distinguished speakers. So the first sequence of this panel will be on policy support for social health protection with a guest from Laos and Burkina Faso. And how the ILO provides this support through the flagship program. Then the sequence 2 will be on capacity building for social health protection. And we will focus here on the activities that have been provided to build the capacity of the institutions through the ASEAN EHD and our colleague from the GIZ P4H country focal points. And then for the second 3, we will talk about partnering for social health protection, showcasing our partnerships and how they have made a difference in the implementation of the flagship programs with great results. So we have the honor to have the Grand Duchy of Luxembourg today, as well as Team Belgium. And we will conclude after this sequence. Next slide, please. So a bit more on today's speakers, and I thank them again for accepting our invitation. We have a variety of regions, countries, and organizations today, so this is a real pleasure for us. So the first speaker will be Soutthasone Taichanthone, who's technical officer at the National Health Insurance Bureau of Lao PDR. Then Séverin SOMDA, who's Director of Budgeting and Management of the National Fund for Universal Health Coverage in Health Insurance, in Burkina Faso. We will then have Alina Pant, who's lecturer at the ASEAN Institute for Health Development of the Mahidol University, based in Thailand. Kuki Tarimo, who's P4H, providing for health country focal point in Tanzania and health financing advisor for the GIZ. And for the last segment, we'll have Thomas Lamar, who's chargé d'affaires at the Embassy of the Great Duchy of Luxembourg in Lao PDR, as well as Charlotte Taylor, who's public health and social protection expert in the Team Belgium. The closing remarks will be provided by Lou Tessier, who's health protection specialist at the ILO. So I thank again all speakers today. Next slide, please. Okay, so now I will move on to the opening remarks, and I will ask Valérie Schmitt to please take the floor. And I thank her again for her availability to introduce this webinar, to please take the floor and provide the opening remark. Thank you so much.
Thank you, Mathilde. Thanks a lot for inviting me. So, dear representatives of governments, workers, employers, organizations, dear social protection and health experts, dear colleagues and participants, a warm welcome to all of you. Today's webinar brings together a diverse range of participants, as Mathilde explained, including development partners, government representatives, social partners, and colleagues from the ILO, GIZ, and others. Following the previous two sessions, one on unemployment protection held in January and one on statistics held in February, this is really the third session, as Mathilde recalled, of our six-part webinar series for 2026, entitled Building Social Protection Floors for All, Key Achievements and Future Priorities of the ILO's flagship program. So this webinar series aims to showcase the key achievements of the second phase of the flagship program from 2021 to 2025, to highlight priority thematic areas and strategic approaches under the third phase, which is starting now and will end in 2030. To facilitate knowledge sharing and peer learning, and to provide a platform to engage development partners, governments, national social security institutions, experts, social partners, while increasing the visibility of ongoing and future projects and initiatives. So the remaining sessions in this webinar series will also address key topics, such as extending social protection coverage to workers in the informal economy, social protection and investments, and strengthening the financing of social protection. But today's session focuses on strengthening social health protection to achieve universal social protection and also universal health coverage. So social health protection refers to government-led measures to secure affordable healthcare services and adequate cash benefits for all in case of ill health, in case of sickness, and in case of maternity. The UN General Assembly recalled in September 2024 the crucial importance of social protection and social health protection mechanisms to meet the objective of universal health coverage. So many countries such as Rwanda and Lao PDR, and I'm sure also Burkina Faso, who is online today, have shown that extending social health protection is achievable, even in low-income settings and with large informal economies. Their experience shows that countries with a sustained political and financial commitment and also a rights-based approach can really achieve universal health coverage and leave no one behind. Their experience also highlights that there is a crucial role, or increasing crucial role, that new technologies can offer to really facilitate access to healthcare services. Although social health protection supports two human rights, the right to health and right to social security, it is not yet a reality for all. Our World Social Protection Database tells us that 83.6% of the world's population is legally covered for social health protection, which means that these people have a right to access healthcare services for free or with limited co-payments. However, this percentage of legal coverage drops to 66% in low-income countries and in sub-Saharan Africa. In addition, legal coverage doesn't mean effective coverage, and this is a big issue. In practice, in reality, less than a third of the population is effectively protected in lower middle income countries, and this proportion is less than 20% in low income countries. In this context, it is no surprise that out-of-pocket spending on healthcare is increasing globally. In 2019, catastrophic spending health spending concerned 1 billion people and pushed almost 1.3 million people into poverty. So without social health protection, the most vulnerable do not even seek medical health care. Financial barriers remain one of the main reasons for foregoing healthcare globally, and this directly contributes, of course, to poor health outcomes. Effective access is further constrained by shortages of healthcare services and their inequitable distribution. The Service Coverage Index, which is compiled by the WHO, shows that the majority of the world's population is not able to access the minimum package of healthcare services that are guaranteed by ILO standards, with biggest deficits in Africa and Asia. So this situation is even made worse by very low coverage rates for sickness and maternity cash benefits, because this further puts people's income at risk when they should be seeking care. So those figures further hide important inequalities within countries. For instance, a recent study identified that the main reason for foregoing care among women in reproductive age in 58 low and middle income countries is the lack of financial resources to pay for these health services. So this means that income and also income security, which is provided by social protection, can play an important role in providing not only access to healthcare, but also in achieving health outcomes. So this is where the ILO flagship program on building social protection flows for all is so important, as it supports countries in their efforts to overcome these challenges. Over the past 5 years, the flagship program supported important policy and implementation processes to expand social health protection in over 30 countries. This support spanned across scheme design, legal reforms, actuarial support, parametric reforms, process re-engineering. The flagship program also allowed the consolidation of knowledge and has put at the disposal of countries and social protection experts and social partners a toolkit on social health protection. Today, we will hear from our colleagues and constituents about the ILO approach to social health protection and coverage extension, while showcasing success stories of technical support and joint engagement with partners across social protection and health. Let me underscore the importance of partnerships in accelerating progress at the national level. In particular, the ILO is engaged in several global partnerships with the health sector, and notably the Providing for Health Network, P4H, which allows us to advance the social health protection agenda in a coordinated manner. We are deeply grateful to our development partners who are today with us on this call, and also those who are not here with us today, and who all support the flagship program and invest with us in social health protection. We particularly acknowledge the support from Luxembourg, who is represented today on this call, Belgium, who is here as well, and Switzerland, as well as France, GIZ, and ENI, thanks to whom we have been able to support several social health protection reforms across Africa and Asia. These partnerships reflect a shared commitment to advancing universal social protection and universal health coverage in a coordinated manner. At the end of this webinar, my colleague Lou Tessier will provide an overview of what the third phase of the flagship program aims to achieve in this respect. And in the meantime, and without further ado, I would now like to give the floor to our colleagues, Mathilde Mailfert, Technical Officer in charge of the P4H coordination, and Nathalie Both, who is the project manager based in Lao PDR and covering several countries in Asia, who will moderate today's discussion. Nathalie and Mathilde, the floor is yours. I wish you all a successful webinar and interesting exchanges, and thank you.
Thank you very much, Valérie. Thank you very much for these opening remarks. So we're going to swiftly move to the panel discussion now, as Mathilde outlined earlier in terms of the structure. And so here today, the objective is to present the achievements of the flagship program when it comes to social health protection. And we'll be discussing the conditions and the strategies to support the extension of social health protection, including to informal workers. So we'll start with the first segment, which focuses on policy support, in which we are joined by our colleagues from Lao PDR and Burkina Faso. So I'll first turn to our colleague from Lao PDR, Mrs. Soutthasone Taichanthone, who, as Mathilde mentioned, is the technical officer in the Audit and Health Insurance System Development Division at the National Health Insurance Bureau in Lao PDR. Thank you very much for joining us. So the ILO has been supporting the social health protection system in Lao PDR since 2011 with the support of Luxembourg. And this includes support to the design and implementation of the National Health Insurance Scheme that Soutthasone will be presenting in a minute. So Soutthasone, I'll start, jump right in. I'd like to ask you, to what extent has the ILO's past technical support fed into the design, the administration and the financing of the National Health Insurance Scheme in Lao PDR and its ability to ensure effective access to quality services? Over to you, Soutthasone.
Okay. Thank you. That's a very important and quite comprehensive question. Let me overview a little bit the National Health Insurance Scheme in Lao PDR. Lao PDR has moved from having multiple fragment scheme to a more unified system under the National Health Insurance. Previously, there were different schemes for civil servants, private sector workers, and the general population. These operate separately with different benefits packages and financing arrangement. Between 2016 and 2017, these have been consolidated in a single national scheme, which accepts universal coverage outside of pension capital, including those the informal sector and the poor. The scheme is financed by contribution from employers and employees for formal sector workers, but informal workers and vulnerable groups are subsidized by government taxes. In terms of the benefit package, it's relatively comprehensive, covering essential health services for our patient and inpatient from central hospital to district and health centers. The co-payment applied, they vary depending on the type of service and level of facilities, except for the poor and the formal sector for civil servants, private sector workers, under the National Social Security Organization. The ILO has been a key technical partner, including through the Luxembourg Fund project with support on the legal framework and financial sustainability. The ILO supported with the review of the law on health insurance in 2018, which set the legal foundation for the NHI, but also revision for 2026, which has held informed ongoing policy discussion and potential revision. This is important for ensuring the system remain aligned with social health coverage goals. One of the most important contributions had been actual analysis of health insurance system This analysis helps policymakers understand whether the system is financially sustainable and has also informed decisions on provider payment rates. The ILO support has contributed across multiple dimensions for policy and legal framework, financing, and system administration. This has helped Latvia build a more integrated and equitable health system, insurance system, and improve access to services. At the same time, challenges remain particularly around financial sustainability and ensuring consistent quality of care across all regions. Thank you.
Thank you very much, Soutthasone, for this overview and for highlighting how the NHI has achieved universal coverage, including through unification of different schemes. So I'll move to the next question for you. So we understand that the social health protection system in Lao PDR is in the midst of significant reforms, including in relation to the financing of the scheme, its design, but also its governance and administration. And so I wanted to ask you, what are some of the key priorities and principles that are guiding the process of reform in Lao PDR?
Okay, that's another important question. While the NSIB has made significant progress in expanding coverage, it is currently facing financial constraints. This underfunding has several consequences. It affects healthcare providers. They are concerned about delay or insufficient payments, which can reduce motivation. It can lead to declining quality of care, and facility may lack resources. Out-of-pocket are still relatively high for many households. For example, even though a patient is covered under the insurance scheme, when they go to district hospital, they may still need to pay for certain medicine or services that are not fully covered or not available at the facility. So in terms of objective, the NSIB is guided by three main goals. The first, to promote financial sustainability of social health protection in Lao PDR. Second, to enhance the quality of care for covered members. And the third, to ensure effective financial protection against the cost of accessing healthcare, including for the most vulnerable in society. So in terms of the key priority moving forward, we need to ensure that decisions on design of the scheme are evidence-based. And those the past experience in Lao PDR with CBSI mechanism. Technical support always be needed with level and analysis, but also to fill data gaps. For example, if data show that certain services are underfunded or overused, this can help adjust provider payment rates and redesign the benefits package to make the system more efficient and sustainable. We want to promote consultative process for design of the scheme. This requires engagement with multiple stakeholders, government agency, healthcare providers, and partner like the International Labour Organization. This helps ensure that reform are both technically sound and practical to implement. And we also want to carefully plan to implement the contributory mechanism to achieve universal health, universal coverage of the target population. We want to ensure transparency of the administrative procedures, including registration and contribution collection. It will also be important that this take account of the diversity of the informal economy. I mentioned it that the NHI does not cover venture capital. The CBSI still exists and will continue under the reform. Here, we want to continue our efforts to expand coverage. Finally, we need to think carefully about the design of the provider payment mechanism to promote the fairness is how health facilities are reimbursed and to promote the quality of care. Thank you.
Thank you very much, Soutthasone, for this overview of the priorities in the reform, but also some of the guiding principles, including evidence-based decision-making and participatory and inclusive decision-making processes. So thank you very much, Soutthasone, for your contributions and your participation today. So I'll move over to our participant and our guest from Burkina Faso. This part of the webinar will be in French, so if you haven't already, I would invite you to click the interpretation button at the end or at the bottom of your screen. Donc, bienvenue, Monsieur Séverin SOMDA.
Welcome, SOMDA. It's a pleasure for us to welcome you. As Mathilde has said, he's the Director of National Treasury Control at Burkina Faso. The goal is to protect the population through social protection around health. And so the question for you is, which have been the main steps for the operationalization of covering informal economy? Thank you very much. Good morning. Thank you for your interest in the scheme implemented at Burkina Faso and the generalization. As you have rightly said, we have thousands of people that have enrolled for this program. And in November 2025, we have started the enrollment. But before people can actually started benefiting from these different services in February. In total, it's 80,000 people. As regards the operationalization, we have established a differentiation between the co-payments by members of ILO. Regarding the law you have referred to, there has been an implementation executive order. We have also developed a software to manage in a comprehensive manner health care services. Full digitalization of enrollment process and PMA, and also products, strengthening data protection and cybersecurity have been under the scope of this program. All of this has allowed us to track the different accounts, which has favored transparency all throughout. And the enrollment has let us mobilize hundreds of volunteers to make enrollment more systematic. And we have also been in discussion with lots of service providers before we actually started the collaboration. There are healthcare providers, pharmacists that have been part of this conversation. And there are also ongoing conversations with a number of service providers and with individual ones as well. Before the start of the services, we have started a process in January with all of them to guarantee communication. And these steps have allowed us to have this comprehensive healthcare system in Burkina Faso. Beyond the 4,000 beneficiaries who are already part of the system since November, the implementation will take place in a progressive and gradual manner. It will be expanded to all the agents that have been enrolled through the Management Integrated System or SIGRAM. So based on all of this, the informal economy actors are going to be part of this. So the integration of this community-based initiative will allow us to make sure all the insurance aspects are covered. And I'm going to stop here as a response to the first question. Thank you very much for having walked us through the different stages and for also having highlighted the progressive aspects. And with this, I'm going to move on to the second questions. We know that financing challenges are quite significant. So I'm going to ask you how ILO has accompanied you to guarantee sustainability. Well, thank you very much for this important question. As you know, funding of universal healthcare insurance is a key part of the system. The funding model at Burkina Faso takes into consideration the state funding and also financial penalties applied in case we detect any ongoing fraud. And we try to fund innovative funding. So in connection with all of this, ILO has provided technical and financial support through its social protection key program to carry out studies regarding sustainable funding and healthcare services access in Burkina Faso, which is still ongoing. But we have also been supported by Cinnamon. We need to optimize all the funding channels that are available. So honestly, ILO has helped us throughout the process and in all those aspects. We must say that we are always in the process of conducting studies to improve the systems, and these studies have to do with the financial and organizational aspects, as well as some pilot projects. We are also conducting a study regarding the exoneration of diseases and the corresponding accompaniment of the healthcare administration. And there's also a third study, which is more specific regarding the quotas for the country. And the idea is for the state to be accompanying in this process of providing healthcare. So briefly said, ILO has helped us and accompanied us in every step throughout the whole process. Thank you. Thank you very much, Mr. SOMDA, for this summary and for having highlighted the importance of all the various studies. Thank you again for your participation. And with this, I'm going to move to the next stage in the webinar. So I'm going to speak English from now on.
As I said, we're moving to the second segment of the webinar, which focuses on the work under the flagship program that aims to strengthen capacities of national institutions and counterparts to design and implement universal and effective social health protection systems. And here we're joined by our colleagues in Thailand and Tanzania. So from Thailand, we are joined today by Alina Pant. As Mathilde mentioned, she's a lecturer at the ASEAN Institute for Health Development at Mahidol University. And together with the ILO, the AHD has also worked to develop a master's degree program on primary healthcare management and social health protection, strengthening capacities within the region. And she's also the focal point at the AHD for the Connect Social Health Protection Network, which was established with the support of the ILO and Luxembourg. And this is a network of 18 public institutions and non-profit organizations that aim to strengthen capacities and conduct joint research within the region to support social health protection systems. So thank you very much for joining us, Alina. So I'll start by asking you if you could please provide a very quick overview of the objectives of the Connect Social Health Protection Network and the type of activities that it implements.
Thank you very much for the opportunity to be part of this important discussion. Talking about Connect Network, a brief overview is Connect is a multi-sectoral regional network working on social health protection. It was established with the recognition that many countries in the region face similar challenges in advancing universal health coverage, but there has been limited opportunity for systematic knowledge exchange and collaboration. So the main objective of Connect is to strengthen social health protection systems by promoting knowledge development, capacity building, and also collaboration. Ultimately, it aims to support countries in moving towards universal health coverage and universal social protection in a more coordinated and evidence-based way. So in terms of what Connect actually does, I would highlight 3 key areas. First is about the knowledge generation. This Connect network actively promotes collaborative research among its members. These are not isolated studies, but joint efforts across institutions and countries, allowing us to identify best practices and generate evidence that is relevant for policy. Importantly, Connect also encourages coordination of research, which is beyond donor-driven projects, which also helps create a more sustainable and regionally owned knowledge base. Secondly, it's about the knowledge exchange. Connect provides a platform for continuous dialogue among researchers, practitioners, as well as the decision makers. This includes webinars, technical discussions, and thematic exchanges. For example, the network has already facilitated discussions on topics such as disability inclusive social health protection and also about the long-term care. Just recently, we successfully organized an online event for the World Day of Social Justice on February 20th, which brought together regional perspectives on equity and inclusion in social protection systems. And also, thirdly, it's about capacity strengthening and collaboration. Connect supports learning, not only through the formal training, but also through the peer-to-peer engagement. Members are expected to actively contribute, whether through research or trainings or sharing experiences, which creates a very dynamic and participatory environment. And also an important milestone for this Connect network this year is that for the first time, the Connect General Assembly will be held in person in May 2026, which is hosted by ILO and ASEAN Institute for Health Development at Mahidol University. This is a significant step forward as it will allow all members to come together and also reflect on progress and jointly define future priorities, particularly in research collaboration and capacity strengthening. So overall, Connect is a platform for coordinated actions and for building partnerships, ensuring that knowledge is translated into meaningful improvements in social health protection system across the regions. Thank you.
Thank you very much, Alina, for the overview of the activities of the Connect network and the objectives of the network in terms of capacity building and knowledge generation and exchange. So I'll pass to the second question and the second kind of element in our partnership. I wanted to ask you if you could briefly, under this partnership, if you could briefly outline the work of AHD and ILO in relation to the design of the Masters in Primary Healthcare Management and Social Health Protection that is delivered at the AHD, and how the objectives and the target audience of the degree aim to strengthen the capacities of core social health protection institutions across the region. Thank you.
Thank you. So regarding the master's program, which is under the social health protection track, this initiative is a direct outcome of the strong partnership between Mahidol University and ILO, which was formalized through an MOU in 2019. This collaboration was established with a clear goal, that is to strengthen capacities in social health protection across Asia and the Pacific in alignment with the global commitments such as the Sustainable Development Goals, particularly focusing on social protection and universal health coverage. The Masters of Primary Healthcare Management, which is a specialized track in social health protection, is designed to address the intersection between primary healthcare and social protection systems. This program at AIHD, Mahidol University, aims to develop professionals who are capable of critically analyzing social health protection issues, designing appropriate schemes, and contributing to policy reforms in their perspective, in their own countries. Also, it emphasizes both theoretical understanding and practical application, ensuring that students are equipped with the skill needed to work in complex health settings. In terms of target audience, this program primarily focuses on mid-career professionals from government institutions, national health insurance agencies, NGOs, and other sectors involved in health, financing, and policy. These are individuals who are already working within systems and are in position to influence the change. Also, what makes this program particularly impactful is its strong linkage with real-world practice. Through the Connect network and the partnerships with ILO, students are exposed to regional experiences, policy discussions, and also practical challenges faced by different countries. And we are also already seeing tangible outcomes from this approach. Our graduates are working in key institutions such as the National Health Insurance Agencies, and some have even been promoted to higher level policy positions after completing the program. So this demonstrates that the program is not only building knowledge, but also strengthening institutional capacity. In addition, the program fosters regional collaboration among the students from different countries, creating a network of professionals who continue to exchange knowledge and support each other beyond their graduation. Thank you.
Thank you very much, Alina, for the overview of the master's degree and also the outcomes, including in relation to the networks that are created, but also kind of the strengthening of system capacity. So thank you very much for your participation in the webinar. I will now move to our colleague, Kuki Tahimo. So Kuki is the P4H country focal point in Tanzania and the health financing advisor at GIZ. And in his role, Kuki provides technical support on health financing reforms to the Ministry of Health in the ministry, in Tanzania and Zanzibar. And so the ILO and GIZ have partnered in Tanzania to strengthen the capacities of national institutions in charge of the governance and administration of social health protection, including the National Health Insurance Fund in mainland Tanzania and the Zanzibar Health Service Fund, among others. So Kuki, I'll turn to you now to ask if you can explain why this support was timely and if it improved the implementation of the universal health insurance and the expansion of coverage in Tanzania. Over to you, Kuki. Thank you very much.
Okay, thank you very much for be part of this webinar. And I would like to start by giving a little bit of context so that I can come to why it was timely. In terms of current stretch, and as most of the LDC countries, the larger portion of Tanzanians are in informal sector, and we have key component of social protection aspect at large. We have those income security like pension schemes, workers' compensation fund, health, social protection, and we have also some sort of social assistance which provide cash-based, targeting old age pensions, and also disability, and some of waiver mechanism. Most of these institutions operating with different institutions, and in terms of coordination was a bit of the challenge. So GIZ is supporting actually social health insurance through the bilateral project in Tanzania and also the global project Backup Health, and embarked in strengthening the capacity of these different institutions to support actually the implementation of the universal health coverage, especially in extending coverage to the informal sector. And the capacity strengthening was designed to strengthen the technical and institution capacity of these different institutions that are mandated in terms of supporting the implementation of the UHI. And it was mainly on administering and monitoring universal health insurance, both scheme in Tanzania mainland and Zanzibar, looking at how best we can extend the coverage in the informal economy, and monitoring and evaluation. So the program itself, in collaboration with ILO, bilateral program, Backup Health, and Muhimbili University, actually it has combined methodology of itself to allow actually to learn also from the context. So it was self-paced, e-learning model, live modules, online session, and also in-site training in Turin, and also workshop, which actually was hosted here in Tanzania in collaboration with one of the national institution, university. The workshop actually to now hands-on with the expert from the ILO to provide their technical support on different area. So on this workshop, the one aspect was in terms of now selecting the targeted institution that are supporting the implementation of the UHI in general. So we sit together in countries with different partners to identify and try to map the link and what kind of capacity that the ILO could actually support the country on that area. And we come up with a number of institutions and agree, and those are where the beneficiaries of the training program we had with the ILO. Now, why? This actually was timely. It was timely because we have undergone a major health financing reform in Tanzania, and with the introduction of both mandatory health insurance for both mainland and Zanzibar in 2023. So there was a really need to ensure that this reform is moving and it is implemented, and the capacity of these different institutions are there. So the need was to sustain the high political commitment, to strengthen the technical capacity of these key institutions that we selected to join the program, which include Ministry of Health, Ministry of Finance, these health insurance schemes, and these social assistance program. And also, as I did mention also before, in terms of multi-stakeholder involvement on the implementation, to allow the coordination across the institution and learning from each other. And we have seen quite positive result in terms of the methodology that we used for both mainland and Zanzibar to support in terms of this kind of method of tailor-made based on the country context and needs training. And the other aspect was capacity strengthening in terms of now translating these policies, these laws in actual implementation, and also looking at how best we can we can inform the decision making, including the benefit package designing and the expansion of coverage based on ILO experience on providing this kind of training. So this aspect was part of the module that the teams was getting out of the training package that we developed based on the country need. So in these two aspects I want to point out is like the major advantage was bringing these local institutions together is essential actually for strengthening the social protection aspect. Through this project with ILO, we managed to create a platform with these different institutions for dialogue to exchange ideas, share their practical experience and learn from each other, and also learn from the expertise in terms of global experience. And this kind of collaboration improve coordination and lead to more effectively and context-specific approach in terms of dealing now with what actual the country need. And another thing is by bringing in now the international experience from the ILO offer technical expertise in toiler and demand-driven manner, as I mentioned. These institutions contribute to global knowledge and best practice while aligning this support with the country priorities by working closely with the country team in now tailor this kind of capacity needs. And this actually improve and strengthening the ownership of the country stakeholders that were benefited from the workshop itself and benefited from the stakeholder itself and actually the partners that are working on that area. And from the workshop, from the all program, it ended last year, November. We did receive some positive feedback from our partners in terms of the approach of that capacity building program that we established, and we observed some practical applicability and knowledge to our partner, the one that are implementing in terms of now supporting the implementation of these different reforms that was highlighted in the act in terms of translating now the policy into actual implementation. Thank you.
Thank you very much, Kuki, for the overview of the background and the rationale for the training, including the importance of capacity building and strengthening, especially during reforms, but also very interesting to hear how the training itself created this platform for different stakeholders to engage in dialogue. So thank you very much for that. I'll move to the next question. If you could very briefly discuss, so you're the focal point for the Providing for Health network in Tanzania, and so I wanted to ask you if you could very briefly outline what the added value of this network is, especially when it comes to strengthening the capacity of universal health insurance in Tanzania and the Health Services Fund in Zanzibar. So if you could very briefly, please. Thank you.
Thank you very much for the question. As the P4H network, as one of the remaining, I think it's one of the remaining trusted and neutral platform that enhance coordination and knowledge exchange and collaboration with both partners, both development partner side and also the political partners, which are these institutions such as National Health Insurance and Ministry of Health. Now, the main roles and what actually we have been doing currently is providing an overview of coordination platform for health financing reform for both development partners and also the stakeholders that are implementing these the different health financing reform, and that is one of the roles, and actually leads to coordinating also in supporting the development of these tailor-made support that was made through the GIZ and the bilateral program and also backup health. And we facilitate also learning and offer technical expert through its our global network. We have been actually as P4H supporting the different capacity building, since most of us P4H, I think not only in Tanzania, but where we are some technical expert on these different areas. So by working closely with the our political partners ministry, we easily identify what are the needs and what are the gaps, and we can propose a tailor-made solution in terms of areas that they need strength. They need to be strengthening within the institution, and supporting them actually in participate in different opportunities of learning and meetings and the conference and etc. And but I would like to conclude by saying, like, looking ahead, more support actually is needed in terms of the capacity and based on our challenge to ensure what the sustainability in terms of long-term investment that have been made in the local capacity building and create more accessible regional learning and international learnings, the platforms such as P4H and other platforms, to ensure that these lessons and experience from different countries are there to support the country, different reform, and these actually can help the country to build the long and self-reliant system while also still benefiting from these different expertise from these international organizations such as ILO and others. Thank you.
Thank you very much, Cookie, for this overview and for, again, highlighting the importance of learning from international experience, which also came out in your discussion previously about the training in Tanzania more specifically. So thank you very much, Cookie, for your participation in this webinar, and thanks to all the participants who've already spoken. I will now hand the floor over to Mathilde for the last segment of this webinar. Thank you very much.
Thank you very much, Nathalie. So now let's move on to the last but not the least segment of today's agenda, which is on the vital significance of partnerships to build social health protection systems and extend coverage to all. So now I would like to turn towards Thomas Lamar, who is chargé d'affaires at the Embassy of Luxembourg in Laos. So as a background, the ILO and the Grand Duchy of Luxembourg have been partnering to support the extension of social health protection in Southeast Asia since 2011, with the first project between 2011 and 2015, and the second project between 2016 to 2026, consisting of 2 phases. So the partnership covers in-country supports including Lao PDR, and as we heard from our colleague Soutthasone, as well as at the regional level, as we heard from Alina. So Thomas, the Great Duchy of Luxembourg has been a long-term partner of the ILO in supporting the extension of social health protection in Asia, with consecutive projects focusing on various countries in the region, including Lao PDR and Cambodia in the future. And these activities link very closely with the work at the regional level. So how do these successive projects fit within the Grand Duchy of Luxembourg's wider priorities towards social protection and health in the region?
So first of all, thank you very much for this question. Also, thank you for inviting me to this panel. I would like to start by mentioning that Luxembourg's own health system is built on the principle of universal health coverage, so that regardless of income, our residents can receive high-quality healthcare, because this is indeed also a fundamental human right. In addition to improving public health, we also see that social protection has positive impacts when it comes to reducing poverty, also to fostering social cohesion, and thereby it supports stability, the creation of a productive workforce, which are all necessary for sustainable economic growth. On Laos specifically, Laos has been among our priority partner countries of Luxembourg's development cooperation for more than 25 years now. And in Laos, in the meantime, the health sector is our priority sector. And we consider that one of the best ways to leave no one behind is to ensure universal health coverage delivered through a primary healthcare approach. And therefore, this is also among the main priorities of our global development cooperation strategy. because we consider that nobody should have to choose on a daily basis between food, between education and health services. They should all have that, and everyone should have that. And to do this, we work with a variety of partners. So in Laos, we work with our bilateral agency, Lux Development. We also work with multilateral partners, with first and foremost the ILO, of course, also with UNFPA, UNICEF, with Gavi, the Global Fund, and I should also mention the World Health Organization, with whom we had created more than 13 years ago now, a universal health coverage partnership, which also supports the Ministry of Health in policy guidance and the Lao health sector as a broader sector. We also work with civil society, so with NGOs like Humanity and Inclusion, with Care International, or an NGO, Aide au Développement de la Santé, which is from Luxembourg. And in addition to that, I think research is really key. So we also therefore have partnerships with the Institut Pasteur du Laos, which works closely with the Luxembourg Institute of Health, also the Luxembourg Institute for Science and Technology, to produce research results that can usefully guide policy decisions in the Lao PDR. And actually, most of these partnerships are longer-term partnerships, because we really see that we need to work over time in order to reach sustainable results. And I think the partnerships with the ILO that you mentioned earlier also illustrates this the best. It's a partnership that has been there for 15 years, and now we are looking into how to pursue this partnership. We have also seen that what works very well is really the synergies between our different partners. So the ILO experts work in synergy with Lux Development, for example, also with NGOs. You could have the example of trained health personnel that might have been trained by civil society that work in improved facilities to which Lux staff might have contributed during the construction, and which are made truly inclusive and accessible by the National Health Insurance Bureau, which benefits from the policy guidance of the ILO. So this approach has worked for us in Laos, and as we work closer now with the government of Cambodia, we are also looking into reproducing maybe a similar integrated approach where the ILO can engage in policy dialogue with the government, while at the same time Lux staff stands ready to support the government in implementing its strategy. And I think beyond the coordinated approach at country level, I think it's also worth mentioning the regional initiatives like the Connect initiative that was presented earlier, which come in handy to complement the country level interventions.
Thank you so much, Thomas, and thank you so much for recalling the role of social protection to reduce poverty, enhance social cohesion, and very interesting to see how those different partnerships create synergies and how you exploit them in the long term. So this is really fascinating. So now I would like to ask the second question that we have for you today. So the international donor landscape is currently very fluid. And in turn, Lao PDR is expected to soon graduate from LDC status, which will affect its eligibility to international development assistance. The Great Duchy of Luxembourg maintains its steadfast commitment to international development assistance, as you have explained. So what role can we all play to ensure the sustainability of our interventions in light of this changing context?
Thank you also for this very important question. Our government in Luxembourg has recently reconfirmed that it will continue to allocate 1% of our GNI to official development assistance, and inclusive and accessible quality social services are really at the center of our global strategy as well. Of course, we need to localize and to contextualize this. And you mentioned the graduation of the Lao PDR from its status among the least developed countries this year. And I want to take the opportunity also to congratulate our colleagues for this graduation, because we really consider that a graduation should be a reward rather than a punishment. So I think that's also how we approach this. Luxembourg will stay engaged in our partnership for health in the Lao PDR. We will, of course, have to adapt to the context, to refocus a little bit and maybe to rather support the government to deliver inclusive social services rather than supporting directly the delivery of these services. I think also when it comes to sustaining social health protection systems, one key bottleneck, and I think Madame Soutthasone had also alluded to this, is health financing, because the resources need to be there in order to keep health insurance going. So through LuxDev, we also support income generation by the Ministry of Health, while we want to make sure at the same time that no one is left behind, and that also people that might not have the means to pay for more expensive services can have access to services. And in order for that, we consider that domestic resource mobilization is really important. So that relates also to our broader portfolio in Laos. We also have programs on good governance, which include aspects on anti-money laundering, which are key to really make sure that the necessary resources can be mobilized locally. And in addition to that, I think also the potential that the introduction of health taxes, for example, on tobacco, on sugar, on alcohol, can really represent a win-win opportunity for sustaining health insurance schemes. Here also, I think the ILO is at the center of this discussion. I remember a few weeks back with Nathalie and the Minister of Health, we launched a costing study of hospitals in the Lao PDR. So this is really very concrete input into the policy discussions for the Ministry of Labour and Social Welfare and for the Ministry of Health that are thus enabled to make sure that the schemes are well designed and financially viable, and if possible, cover the whole population so that we can really reach this joint shared objective of universal health coverage. I would like to end by saying also that as governments, we should see our contributions to health insurance as an investment, because I think health insurance specifically has a very high return on investment. It provides safety nets for vulnerable people. It reduces poverty rates and increases resilience in times of crisis of natural disasters or also economic hardship. And I think we are right now in oil crisis where economic hardship is to be taken very seriously. We also have witnessed the COVID-19 pandemic. So I think it's very clear that health and health insurance cannot be separated from these broader considerations. They are also very much part of our daily lives, and the right to health really starts at an individual level and at the local scale. And I think we need to be aware that we can only achieve high-level strategic objectives if we can ensure the right to health at the smaller scale, meaning at the level of the people themselves. Because in the end, it's only a healthy population that can contribute to achieving long-term and self-reliant socioeconomic development of a country, be that in Laos or also in Luxembourg. I think it's the same situation everywhere.
Thank you so much, Thomas. Thank you. Congratulations indeed to Lao PDR for its graduation, and congratulations to Luxembourg for allocating 1% of its GNI to ODA. That's above a threshold that many countries cannot achieve, the threshold of 0.7%. So congratulations. I take away from your intervention the significant role of mobilizing domestic resources for health and really to consider health as an investment and health insurance as an investment. So thank you again for your contribution. So now I would like to turn towards the last speaker for today's event, and Charlotte Taylor for the team Belgium. So Charlotte is a public health and social protection expert at endeavour. So Charlotte, Belgium is a historic partner of the ILO as part of the flagship program and has also been an important contributor to strengthening national social health protection systems in West Africa through its bilateral cooperation delivered by ENABEL, the Belgian International Cooperation Agency. So according to you, what is the role of development partners in supporting countries reaching universal social protection and universal health coverage at a time when overseas development assistance is diminishing worldwide?
Thank you very much, Mathilde. Thank you and good morning all. I'm delighted to be given the opportunity to make some remarks today on behalf of Team Belgium. Thank you especially to ILO colleagues for the invitation. I'd like to start by emphasizing again something we all know, but just to point out that social protection and health system are deeply interconnected, and when they're well designed, they reinforce each other, protecting households from financial hardships while strengthening access to essential health services. For Belgium, this debate speaks directly to the European social model as it encompasses the important principles of solidarity, risk pooling, and financial protection. And in this spirit, supporting social health protection abroad is both a development investment and a way to project these shared values internationally. When it comes to the role of development partners in a context of shrinking aid, I'd like to emphasize that it's mostly important to focus on continued support to national country systems strengthening, more so than financial coverage, through its bilateral cooperation through Enable, but also through multilateral partnerships such as the ILO flagship program. Belgium has been consistently investing in institutional capacity, governance, financing strategies, information systems, often with a long-term vision of systems building. Now, development partners also play an important role as catalytic investors. Often we have the opportunity of using grants, delivering technical assistance to also take some level of risks and work with our partner countries to test new ideas on the ground. And this is also an important contribution to building social protection systems, and often very much backed by evidence generation and contributions to policy dialogue. And here I'd like to mention a few examples where Enable has started very small with, often pilot or initial initiatives supporting the introduction of social health insurance systems in countries like Rwanda, Niger, Senegal, and we see that over a decade or two, we are really reaching scale and have been able to support these countries in leveraging more resources for these systems. And more recently, we have also started with initiatives in Guinea and Mauritania. Of course, we also recognize that recent global shifts in overseas development assistance are a wake-up call to all of us, underscoring the need for more efficient and effective collaboration among development partners to maximize our collective impact. And when it comes to Enable and the ILO, for example, efforts have been underway to strengthen our collaboration in social protection, but also in the decent work agenda in countries like Benin, Burundi, the DRC, Guinea, and Senegal. And it could be something as small as starting a simple technical collaboration, information sharing, coordinating our actions from a fully all the way to, in some cases, a fully fledged partnership agreement through which we have been, for example, in the case of Benin, leveraging ILO's expertise to add value to Enable's intervention on the ground. as resources tighten, I think it's also important to emphasize that the role of development partners is more catalytic, and another way of being more catalytic is by continuing our efforts to support policy dialogue and fora which brings the conversation again around social protection and health at the center. We had the opportunity as Team Belgium to partner with ILO, UNICEF, and other agencies at the World Social Summit in Doha, and we delivered together a side event on social protection and decent work, which put youth at the center. And building on this collaboration, we organized in Brussels a couple of weeks ago a conference, again with ILO, this time also with the European Union, with AUDA NEPAD and many others, on the importance of building synergies for social protection. So I think this is really important to continue this investment, especially bringing together like-minded partners around this important agenda and keeping the momentum on this important agenda. At the conference in Brussels, we heard from one of the senior government officials in his remarks that in this moment of declining ODA, it's also we also have an opportunity to rethink the broader health financing ecosystem, and perhaps the gradual rollout and consolidation of social health insurance schemes in the partner countries in which we work are part of the solution. I believe so, and as a way to enable a transition towards more sustainable domestically financed system. Now, as Valérie mentioned earlier today, we know that reaching universal social protection and universal health coverage is fundamentally political. And in line with this, I would like to appreciate and recognize the efforts that we have been seeing at the global stage to keep, national ownership and domestic agendas at the center. And we have, for example, seen how the UN Global Accelerator is putting an explicit focus on country-driven processes and national strategies supported by high-level commitment. And I think that in this context, partners should continue to play a key role in supporting national dialogue, strengthening the social contract, aligning social protection, health, labor, and fiscal policies, rather than promoting fragmented project-based solutions. A key lesson that we have seen in the ILO flagship experience is also that social protection cannot wait.
If you can just provide it in 1 minute, because we will need to then have time to close. Thank you so much,
Just
Charlotte.
wanted to put a very important focus as well on the importance of formalization and appreciating the efforts underway to support the informal sector through various initiatives to use, for example, social health protection as an entry point for the formalization process. And at Enable, just to say that we're also embracing this integrated approach by breaking silos more and more between the support we give to the health sector and to the entrepreneurship sector in a number of countries. So I'll just end by saying that these moments of peer learning like today also are critical. And thank you again for bringing us together. And just to emphasize again that, strengthening systems, supporting the transition from informality and aligning behind country-led initiatives remain very much at the center for the Belgian Corporation. Thank you very much.
Thank you so much, Charlotte. Very important points and insights, and thank you for reminding the role of the catalytic role, really, of partners, and this need also for greater coordination and dialogue between us, among many other points. So now we are at the end of the panel for today. I would like to thank all the speakers for respecting the allocated time. I know we had many speakers today, and for bringing so many different insights from different regions and organizations. I think it was really a very interesting panel. So I would like to now turn towards Lou Tessier, who's health protection specialist at the ILO, and who will deliver the concluding remarks for today's webinar. Thank you, Lou. The floor is yours.
Thank you. Thank you very much, Mathilde. And thank you very much to all our panelists today. I think this was a wonderful lineup, and it's great that we have this opportunity to showcase really concrete progress at the country level. So, you know, I won't hold everyone much longer. Just to give you a bit of taste of, based on those learnings, what we're planning next for the next phase of the flagship program. If we can go on to the next slide. Thank you. So just to recap that the vision of the ILO flagship program on building social protection floors for all is a world where all still excluded have access to adequate and comprehensive social protection across the life cycle. That obviously this aims at preventing poverty and reducing inequalities. And here, when we talk about comprehensiveness, we indeed talk about accessing healthcare without hardship through social health protection, but also addressing the social determinants of health through a package of social protection benefits that also support income. And also a world where national social protection systems are right-based, build on social dialogue, and are well governed and adequately financed. I think financing has been discussed at length in the panel discussion today, but I think we would also like to emphasize the rights-based approach, which in the current context, in the current global and multilateral context remains extremely relevant, and also where the flagship program has an extreme added value, since rights-based approaches and international conventions are what really the core added value that multilateralism brings to the table here. We also articulate a vision of the world where social protection is considered the primary objective of public policy and a necessary tool for achieving other policy reforms, including, as been mentioned, economic and employment policies around formalizations, but also health and climate policies and investments. We can go on to the next slide. In that overall vision, we have articulated an approach with 3 pillars, one being country support to build social protection system, the other one strengthening the knowledge base, then building and scaling up social protection systems, and on pillar 3, expanding our strategic partnerships and trying to really be a convener, as we believe that as a multilateral agency, this is one of the key advantages we can bring to the table in this respect. We can go on to the next slide on how this approach is then being articulated when it comes specifically to social health protection. Under this pillar 1 of country support to build social health protection schemes and extend them, we aim to consolidate our support to countries with high potential for impact. As we go on to this next phase, the idea is not to drop the support that has been provided to countries already through phase 1 and 2, since about 30 countries have benefited from this support with high impact. We want to consolidate those gains, but also to focus on institutional change anchored in national framework and legislations and systems, and eventually impacting people and showing how we impact people. We offer a comprehensive range of support on how to manage and finance the risk of ill health through national dialogue and national strategies on social health protection, but also anchoring social health protection within both health financing strategies and social health protection strategies, and have joint advocacy strategies for financing across health and social protection sectors. We also provide support on the design of schemes with analysis of needs and participation at the core principle of this design, and definition of coverage parameters and affiliation modalities that are in line with the international normative framework that is at the heart of multilateralism and the consensus that has been gained and built with all member states of the United Nations. And then also support at the implementation stage with economic and actuarial analysis that guide the sustainable financing of schemes and support to governance and management of operational processes that ensure transparency and effective access to rights holders. If we go on to the next slide, this is complemented by a second pillar on strengthening the knowledge base for building and scaling up social health protection. I think here we can see that we have articulated this knowledge base around comparative analysis across countries, but also a number of technical tools and manuals that build on this pillar one of country support and what we're seeing and what we can articulate and that can be shared as good practice on a number of technical topics, including capacity building generally, but also policy guidance, legal drafting, and actuarial modeling for health. We have also an axis of consolidation of data and statistics on coverage and gaps. The World Social Protection Database builds on the ILO custodianship for SDG 1.3 and supports global monitoring frameworks and the building of such monitoring frameworks at national and regional levels as well. In addition, in this phase, we are going to also look at how social health protection can support transition, a number of transitions. We can see that with the demographic and epidemiological transition at the global level, we need to integrate social health protection with other policies to increase their social impact. We need to address the needs and the specific needs of populations that are still largely excluded, such as informal and rural economy workers and their families. We need to link social health protection with the care economy and support gender equality. We also need to support the visibility of social health protection and social protection investment in their impact on addressing the social determinants of health, as this is a key axis to actually do joint work and foster joint work across social protection and health sector. And we obviously need to keep addressing social health protection in the context of climate change and in crisis context that unfortunately keep unfolding in the global context. And if we go on to the next slide, we can see that we believe we can only do this through strategic partnerships across social protection and health sector. And we indeed, as this has been highlighted by a number of interlocutors today, see very much our role as the multilateral agency that has the mandate for comprehensive social protection international conventions. We see ourselves as having a convening power to indeed align within the UN, within the United Nations. This is already something that has been clearly highlighted as a priority within the UN collaborative on social protection, but also much broader with all partners that are involved, not only obviously our member states and social partners, but also bilateral agencies, academia, and others. And this is how we will be bringing impact to scale, through global advocacy, through capacity building and knowledge management, and through direct country support and impact. And with this, we can go on to the next slide. And I will thank you for joining us. I'm only 1 minute late on the program, so I hope that with this you had a good webinar. Thank you again to all panelists and participants for being here, and thank you to socialprotection.org for facilitating this meeting.
Thank you so much, Lou. Thank you for rushing through your conclusions, but all points were well noted. So thank you everyone for joining us today. This is the end of the webinar. Please, you will have a survey popping on your screen. So I was specifically asked by socialprotection.org for you to please pay attention to this and fill in the survey, please. We hope that you enjoyed it, and we'll see you next time. Thank you so much. Have a good rest of the day.